You're live. There you go.
All right, we're going to start this special meeting of the Plainville Board of Education. And our purpose this evening is to discuss some of the testing options related to COVID. And we do have a few guests that are going to be joining us for our discussion. So that's all you're going to hear from me. I'm going to kick it over to the superintendent to introduce our folks.
Thank you, Chairwoman Tyrell. I thought it would be a good idea. There had been a lot of communication regarding testing options in our, in previous message I've sent out, and I know some of our board members have asked questions about different testing options and made some, suggestions about inquiring about other options as well, including potential for like an in-school clinic or pop-up type of clinic at a school. So I just wanted to kind of go through that. I have talked extensively about those options with Julie Simard. I'm sorry, I should introduce Julie Simard as our COVID liaison for the district. And I can't say enough about Julie. She works around the clock. Stacy Buden, Stacy's also on the call. And between Stacy and Julie, it's quite the duo. Julie does a lot of the work with, or primarily the work with on the student side in the contact tracing with the the principals and the school nurses at each school who are terrific, and then working in partnership with Stacy and I, Stacy with all the staff, anything to do with the adults and the staff. But we all work together, and they do a tremendous amount of job. They do all the calling, so they have the toughest part in making all those delicate conversations and explaining everything and all the requirements. So I just want to thank them publicly, as I've done before, and I'll do a lot more over the coming months. But we also have Rick Daigle, who runs the Griffin Hospital testing over at Tungsten, correct, Julie? And
that's correct, yes, yep.
And he's going to be joining us. Dr. K is very busy, to say the least, over at the Doctor's Treatment Center. He's our consulting medical advisor for the district. He's been instrumental and tremendous with providing a lot of really good options, really quick options for members of our community who need testing, who are symptomatic or asymptomatic, but a close contact who want some reassurance. So Julie can talk about some of that in a bit. And then I have a statement from Shane. Shane doesn't really attend meetings. He attends kind of the town board of finance meetings, but he doesn't really attend board of ed meetings. So he had provided me with a statement and some information regarding the testing and what his opinion is with especially the Buy Next Now testing in schools. So I guess I'll start there, and I did send out, just to give a backdrop, I sent out, Plainville by the numbers in my last principals, that was a while ago, superintendent's message on Friday, just kind of giving an overview. We keep really close track of all the cases that are identified in our school district between the students and the staff. We have had over the 4 days since then, or 3 days since then, we have had 4 additional cases. So we're up to 92 individuals in the district since August, when the staff came back, 68 students and 24 staff members. As I wrote in the message, zero confirmed due to in-school close contact. In just about every case, there's been a close contact at home, a relative, a close family friend they spent time with who was positive. And, the contact tracing led, directly to that close in-home or very close contact. There have been a couple of situations that potentially could have been a contact in school, but we really had little evidence to show that was transmitted in school. The transmission rate in school has been extremely low, and that's true across the state and across the country. Just talking to other superintendents and leaders from around the state and hearing from around the country, that's been a common experience. And considering, also in those numbers, just considering the number of days we've been in school, more than a lot of districts in the state. We've had, the 21 hybrid days to start. We had 51 full in-person days. I did do the 8 fully remote days. Veered a little bit from health guidance on that, just because I thought it was sensible to do with all of the administrative strain with staffing. Both after the Thanksgiving holiday and then the 3 days, 2.5 days before the winter Christmas and winter holiday break. So those were the 8 fully remote days, and we did have the one traditional snow day with a traditional snowstorm of pretty epic proportions, especially up north. But so that brings us to today's the 81st day of school. 80 of those days count. We have to make up that one day. So that's kind of, we have 2,261 students in the district as of at least a couple of days ago. We have about 430 or so staff. The number ebbs and flows a little bit, but we have around 475 students who are fully remote track C at this time. So, just giving you an idea of how many students are coming into the buildings each day, following all the mitigating strategies, doing a really good job. And Julie has spoken about what a good job the parents have done as well. If their kids are sick, of keeping them home. If our staff are sick, of them staying home. So that's really helped a lot as well. But all of that being considered, just looking at today's report from the state and from Bill Pettit, he shares it with me every day. Plainville has had, they have the cases of 957 cases, and then it says cases that are positive, 1,113 in the town since this all began in last March. 29 deaths, and the rate of when they convert it to a rate of 100,000 people, which is the system they use, it's 5,430 or 5.43% of as far as the rate goes for Plainville. And then there have been Plainville residents, 21,809 tests conducted at this point. So, that just gives you a little bit of a backdrop of the numbers of I'm going to ask Julie if she could share just some of what's happening with the testing at this time and her experience with Doctor's Treatment Center, Dr. K, and Rick Daigle from Griffin, and anything else you'd care to share about testing, Julie.
Sure. So I think that there's 2 different types of testing, asymptomatic and symptomatic. And I think there's general agreement that we don't want to do symptomatic testing in the schools because we don't want sick students and staff coming into the buildings. The nurses are doing a great job tracking illness and guiding families to testing in the community when their students are sick. Dr. K and Shane Lockwood both agree that these students really should be staying home so they're not spreading COVID in the schools. But I think the question for tonight that we want to discuss is whether or not we should be offering some type of asymptomatic testing in the schools. And this really means offering PCR testing to the staff and students who are well, not sick. Currently, Dr. K does not support either type of testing in the schools because the state isn't recommending it at this time. And if they do recommend it, he would be happy to help us coordinate that. So instead, the nurses are referring all of the students and their families, whether they're sick or well, to community testing sites or to their own doctor for guidance on testing. Not all doctors do recommend testing for students. It really is a case-by-case situation. But we use the 211 service of the state to locate testing sites for families. And we've got quite a few testing sites in the area. We use mainly Griffin Hospital, which is at Tungsten all day on Thursdays. It's been so helpful. And they get results to us really quickly in about 24 to 48 hours at the latest. We also have Plainville Senior Center, Community Health Centers there. They're testing most days on Tuesdays, most weeks on Tuesdays. Community Health Center also has, I think, about 4 testing sites now in New Britain. They also have 1 in Bristol. And we also obviously have the Doctor's Treatment Center, which is run by our own medical advisor. It's open 7 days a week for testing. They also do flu and strep testing, which is also very helpful. All of these testing sites are free except Doctor's Treatment Center, but really people going there tend to be more sick. They do have asymptomatic testing, but they really do need consultation with a physician. Maybe also to have flu and strep testing to sort of get to the bottom of why they're not feeling well. So Rick Daigle is from Griffin Hospital, and he's the Chief Information Officer there. He also is helping to coordinate state testing. I know he runs the Tungsten program, and he was going to come tonight to sort of talk about the options for PCR testing, what might be involved if we offered it in the school or like a little pop-up in the town. I'm not sure if Kevin, is he logged on yet?
Looks like he's right there, I think. Yeah. Hi, Rick.
How you doing tonight?
Good, how are you? Thanks for joining us.
Oh.
I may have a few other staff members that join me. Todd Liu, which is our general counsel, and Patrick Shermell, our CEO, may be joining the call. I know we were in the process of talking about vaccination, so everybody's really busy here across the hospital to see what the next steps are in regards to the this COVID pandemic.
Well, thank you so much. Thanks, Rick, for taking a few minutes to answer some questions. So would you just explain the difference between if we were to have, have a PCR testing in the school, say we had it at the nurse's office and we're collecting insurance, or if we didn't do that, what the cost would be if the district were to pay for the testing?
Right. So, there are some challenges as it relates to providing testing on site. One of the things that we'd have to do if we do testing on site at the school system or a location designated is the DPH needs to be involved in order to classify or certify that location for a testing site. When we were doing the colleges or we're doing the nursing homes, because it's a clinical environment, it operates under a different process. But when we're dealing with a school, if we're dealing with a business, or we're dealing with the municipality, we need to go through stringent guidelines. So we would have to designate a specific location in the school system based on what the requirements the DPH requires us to perform in an environment where tile floors, non-porous surfaces, specific items in order to test with. In addition, they usually want an egress, an entry and an egress and exit areas strategy so that staff or students or anybody is not bunching up. They want a one-directional flow. And then one of the other challenges many times that we have seen at some of the other locations is that air exchange, very important. When you're testing indoors, you have to be very mindful of how many air exchanges. I think they're looking for 5 air exchanges an hour in a specific location if you're testing within a building. So as it relates to the, what was the second part of your question in regards to?
So if we were to say we were to get approval to do this at the Department of Public Health or local Department of Public Health, we're wondering about paying for it. Would we be able to bill student or staff insurance, or would the district have to just pay, like, for example, buy a certain number of tests?
Yeah, I mean, I think we'd have to define what you're looking for exactly as it relates to testing. There is a possibility of billing insurance, but the way we do it with the state does pick up all of our testing fees. And I know that Todd Liu, we can give you more of a definition as to what that process is that we have the understanding or the agreement with the state. It's slightly different. There are ways that you can bill against insurance, but keep in mind, depending on how many students or faculty, it does add a degree of length of time to process. So as an example, when we're doing our pop-up sites, like at Tungsten Community College, or when we're doing some of the colleges or the nursing homes, the testing time is significantly quicker. Like as an example, when you go through Tungsten, regardless of the line, the time that I take your information, I process it on my system, I issue the label, I swab the patient, it can probably be less than 12 minutes for processing time. When you add the insurance and commercial insurance, it gets a little more complicated because now it depends on what the payment structure is. It does add a degree of complexity. Now, that doesn't necessarily mean we can't entertain something. It's just a matter of understanding what exactly you're looking for, volumes. as an example, right now we're being faced with the colleges going back to school. 4 colleges in Connecticut. We're probably talking about 7,000 students. The colleges come to us and said they'd like us to start processing insurance for 7,000 students. That's something we have to look at very closely because of the degree and complexity of trying to push 7,000 students a week for testing adds a little more complexity. If you're talking with a very smaller population, obviously it's something you can control, may be doable, but it's something we'd have to work out and look at very closely to see what the complexities will be.
Mm-hmm. And then if we wanted to have a sort of a pop-up at the town to service the town, that would have to be a state grant, or we would buy an individual or a certain amount of tests for that as well?
Well, I don't think if you wanted to do a pop-up for the town, like the town would entertain this, or are you talking about the school system itself?
I'm just wondering if the school system is part of the town, maybe that might be one approach for it too. What would
yeah, so I guess, I think if you're looking for it to be a state-sponsored event, you'd have to reach out to the state directly to see, and it's not that they haven't done that before. I know that when we were working with the town of Norwalk, I know it was a state-sponsored event that they actually had us come down and do the testing for the town of Norwalk for that day, which also encompassed the surrounding towns. As an example, we're in the Trumbull location right now, which entertains Monroe and a few other surrounding towns based on the volumes, which we process about 800 people a day there. So it really is, if you're going to look at it for a state-sponsored, which is not unrealistic, and again, keeping in mind, depending on what they constitute as a hot zone for COVID testing, they may or may not entertain. I can't speak for them. We're really running it as an agent of the state of Connecticut. If it was a town-sponsored event, I think we would just have to talk with the town and itself and how payment would be processed. If they were doing it for the general public, we'd have to work through that because I don't think we would move forward with something where we want to do individual insurance, just from the standpoint that it would take an enormous amount of effort in order to process an enormous amount of people. It just would not be beneficial for either party.
And do you test in any public schools now in Connecticut, or just colleges?
Right now at colleges, we had been approached early on with many of the school systems and in some of these areas here, but given the complexities of the testing and the availability that was in the community, some of them backed away in doing the testing. Again, keep in mind when you start working with the students, you need to have consent from the parents. You can't just test this, can't test it under age 18 or younger because they're not considered an adult.
Mm-hmm. Okay.
Like now, when you go through the testing sites, anybody that comes in that's underage needs to have a consenting adult with them or their guardian.
But at school, would we, if we had written consent from a parent, that could be done, or the parent would have to be there?
I would have to ask. I'd have to ask our legal counsel how they define that. I think they're going to say that they may go with the. I guess I'd have to talk with my legal counsel here at the hospital. Todd Liu, who was hoping to jump on, he could give us some clarity on that. But I know we would need a consent form if we were going to test the student, at minimum.
Okay, well, I thank you, Rick. I think you've explained, what would it would entail to have the testing in the school. Mr. LePage, does anyone else have a question for Rick before you go? I know you're busy, Rick.
Rebecca?
Yes. I'd have to do a little bit more checking, but from the way I understand it, Middletown High School runs theirs as pop-ups, and it's not just to the students, it's to the community as well. They have a drive-up setup, so the students are accompanied by their parent as they're driving them, but the community can come through as well. So in a setup like that, would that be possible to possibly set something up with the state?
Well, that's not the public schools running that. That's a community health center running that.
Well, the community health center is hosting pop-ups at Middletown High School.
That's
the same
right.
way I would be asking if Griffin Hospital could host pop-ups at, say, Plainville High School, open to students, community, whatever, billed to the state. So just different companies.
That would require.
And that has to be approved by the state in order for the state to to deem that as a pop-up location. That's part of their program. Again, the program that we're running, we're contracted with the state of Connecticut. We're just a testing partner per se. Even though it's Griffin branded, we're a testing partner for the state of Connecticut.
Got it.
If the state of Connecticut says, I would like to do testing in Plainville, and they designate a location, we all agree to it. The Plainville says, we would like to use the high school. First off, the traffic pattern works for us. We can get people in there. We can get the tent that we would use for the testing location. We bring up our RV, our customized RV that has all the data systems in there to provide that. That's an option. But again, in order for us to open up a testing center for the state of Connecticut, even if it's a pop-up for the day or the weekend, it needs to be approved by the state of Connecticut. They will deem it like as a hot zone. Now, I'm not saying that they haven't done that for other towns. The town has to take that initiative. We can't speak on the behalf of for the town.
Okay.
I mean, just so you're aware, when we have run these pop-ups before, we've run anywhere from, depending on how that's marketed within the town or the regional area, it's probably processed over 200 to as much as 800 cars in a 6-hour window. So Patrick Charmel, our president, just joined us as well on the call.
Okay. You have any other questions? I think
Patrick, one of the questions that the Board of Ed was asking is if there was what is the process in which if they wanted a state-sponsored testing area in their town as it related to, if they wanted to do it at the high school, and what avenues they would approach on that. Can you give them any direction of how they would approach that with the state?
Yeah, so if it's part of the state's outbreak testing program, which the state pays for, you'd have to go through Michelle Gilman in the governor's office. She was responsible for outbreak testing. I believe she still is, but she's now transitioning over to vaccination. If you want us to reach out to her for you, we can, but she has to make that decision because, again, it's a state-funded program.
Is there a certain threshold to be considered an outbreak, or is that just the term for it? Is there a contagion?
It's called outbreak because remember when they started publishing the map with the infection rate by town, where there were only a handful of cities and towns that were red, but now they're all red. So technically, all the towns qualify, but she's tried to regionalize it. So as long as it's a reasonable commute from an adjacent town and that town could be served, she'd do it. You can't have them everywhere just because it's a big resource commitment. For us and others that are doing this, they're pretty difficult to establish. But if your region is not well served, you might be able to make a convincing argument.
So I guess my question is, given what you know about our region and the testing that's available, would you think this would be beneficial to the school district to pursue additional testing? I'm not sure if you're familiar with our rates and our situation, but I know that there's been a lot of question about the asymptomatic test, and I'm thinking that at the drive-through pop-up testing, it would be more people who were either symptomatic or had a concern that there might have been a close contact of someone, or maybe preparing if they have a relative coming to stay with them and they want to make sure that they're okay or something like that.
Yeah, it's kind of all of the above because they're not non-scheduled. So people are accessing the drive-through testing centers, the so-called pop-ups, because they can't get appointments in the scheduled locations. And, there's a pop-up somewhere in the state every day. And they're high throughput and the waits are pretty, at least in the Griffin facilities, they're pretty short. Mm-hmm. So tell me what you know about available testing centers in your region. Where are the closest, because that's what Michelle's going to ask you. Where are the closest facilities? Where are people going now?
Julie, you want to share?
Yeah, sure. They're mainly, they're going to your facility at Tungsten Community College, the senior center, community health centers in the senior center once a week, most Tuesdays. They're also going to about 4 community health center locations in New Britain. They're going there, 1 community health center in Bristol. This is all for free testing.
Right.
And then the Doctor's Treatment Center is a walk-in clinic in Plainville. They're offering both PCR and Binex testing. And they also have, they're set up to take care of sick patients. They do flu and strep testing. Those are the main ones. I mean, people are traveling outside that area to go to Hartford, Go Health in Avon, West Hartford, Waterbury. But, that's not people's preference, obviously, but they do have rapid moleculars. And so people are seeking those out.
Yeah. So,
but otherwise, just the ones I mentioned, which is, the community health center locations, and then Tungsten, really, those are the main 2.
The concern with our current locations for me is the senior center once a month is 9 to 1, so it's not very accessible for students or our staff members to go in during school hours.
right.
Tungsten has been phenomenal. It's 11 to 3, so that even pushes it close for elementary and middle school staff and school members. Community health is daily from 7 to 4:30. That one is 7 days a week. But I was really concerned about asymptomatic testing and our community rate numbers and percentages going up within the community and what we can do for asymptomatic. So we do have some locations like that, but I don't know that they're that available for our students or staff.
Not quite accessible enough. So community health center, they're not doing asymptomatic?
They are.
Oh, yeah,
Yeah.
they are.
And they are open extended hours.
We have
Correct.
those in surrounding towns till 4:30. Yep.
They have the expedited testing for educators as part of the new availability to speed up the process of if an educator wants to be tested, and we sent that information out to the staff.
Well, listen, I think those are the questions that Michelle would ask. She might make the case that there's testing available and that she doesn't think there would be enough demand to support another drive-through testing site as part of the outbreak program, but it can't hurt to ask.
Yeah.
Okay.
Patrick, one other thing that they had asked early on before you jumped on the call was as it related to insurance, taking insurance for testing. And I did indicate that typically we usually have a client-sponsored event that they would, payment is usually provided during the testing process.
Mhm.
Not necessarily collecting insurance. I think it would be based on volume. I don't know if you had any opinion on that to provide any information for that.
Yeah, so if it's for us, just for Griffin, so if it's the outbreak program, that's paid for by the state. But Michelle and the powers that be have to agree to do that. If it's not part of the outbreak testing program, then we have to bill insurance or set up a client relationship with a sponsor. So if the town wanted to pay on behalf of students and teachers, for instance, and not bill their insurance for whatever reason, we could do that through a client billing relationship. But the only testing that gets done for free is tests that are paid for as part of this outbreak program. And most folks have said just, bill insurance. Insurers have been pretty liberal about what they'll pay for.
Mhm.
We just received information about the ESSER2 funds coming out to Connecticut and close to $500 million for education. And then I know Ms. Board Member Martinez had mentioned that she heard there was sounds like a pretty precise number, the 205,212,000 and change dollars coming out specifically for testing. Do you know anything about that or what options that's going to open up?
Yeah, so in the latest relief bill, there's a little over $200 million for testing, tracing, and vaccination.
Okay.
And there's vaccination is separate. So it's mostly testing and tracing. So again, the nursing homes in Connecticut are still testing on a weekly basis. And that's a big population. Griffin alone is doing about 30,000 tests a week. So those federal funds are paying for that. And state employee populations are being tested. All the outbreak testing that we just talked about is coming out of those dollars.
Okay.
So I don't think could access those dollars directly. The only way you do that is, for instance, through Michelle, if she agreed to do outbreak testing.
So that's really to continue the testing that's happening in the locations. It's an extension of what you're doing to pay for that.
Yeah, and I don't know that the municipality, for instance, could access that money and say, we want to run a testing program for municipal employees and teachers. At least it's not I don't believe that's possible yet.
Right. Yeah, I haven't heard anything about such programs in any of the districts that I'm connected with.
So right now, when teachers, for instance, go and get tested wherever they're going, community health center, for instance, or one of the physician practices or urgent care centers, they're just billing insurance, correct? That's the...
Well, the community health centers those are no cost, my understanding. You just, for the drive up.
So
I know from experience, because I went to one, and you just, you don't have to give them your insurance information. You just get,
right.
And
so that's part of the outbreak program.
Yeah. When I was there, it took almost 3 hours, but that was, maybe it was a bad day. Fortunately, it was negative.
Good.
But I've heard your site at Tungsten is much quicker, and the results are much faster too, because my results came in about 8 days.
Wow.
Yeah, it was pretty significant wait period.
Yeah. So again, and I hear what you're saying about the accessibility of Tungsten for teachers who are working past 3 o'clock. We've heard that come up in other communities. Part of the problem is that we've got to get the specimens to our laboratory so they can be processed to keep that turnaround time that, we're committed to.
Yeah.
I don't know if that we can work together in some way to create some capacity to be able to address your specific need as part of that outbreak program at Tungsten. Again, because it's intermittent, right? It's when somebody has an exposure, they want to be able to come and get tested, and you want them to get tested quickly.
We've been able to meet those needs. Julie, am I correct with that? At least anything we've known about, we've been able to get them in for a pretty quick test through Doctor's Treatment Center.
Well, and Tungsten is open all day now. They're starting at 9:30, so that's helpful. And honestly, if a teacher or a student wasn't feeling well or had a close contact, they wouldn't be in school anyway. So,
right.
Right. So they'd be heading down there, and so it has been really fast and accessible, and we've really heard a lot of good things about it.
It's really more the asymptomatic testing as a screening measure. I think has been the the interest that we've had some interest in.
So have you talked to the town of Plainville about funding a screening program, or they just don't have the resources to do that?
I don't know what that would entail. I know the colleges are doing it, or some of the colleges are doing that pretty extensively, and
right.
I know there's a pretty heavy price tag to that.
Correct.
Because it has to be periodic, regular, and I don't know if it's more random or scheduled or how that works, but I know I've just heard from friends who have children at college that it's a pretty extensive program. So no, we haven't had that conversation. Just looking at I went through the numbers before you came on, but looking at our cases that we are aware of that happened, that were brought to the schools, or positive people in our school community, of about 2,300 kids and about 430 staff since August. We're at about 90. We're at 92 cases.
Wow.
In total so far. I'm sure there could be asymptomatic cases we're not aware of, and there likely are. I guess it's finding that right balance of what's best for a school district and what's recommended. You know, the asymptomatic, you know, the Binax Now testing hasn't been advised. You know, our local health director, Shane Lockwood, has not advised that at all. It's really only symptomatic testing that he's recommending be done outside of the schools. Because you know, with the Binax, it would just be
a very high false negative rate.
Yeah, high false negative unless you're symptomatic. So,
well, maybe another way to think about this is if Tungsten is meeting your need in the short term. So teachers are in phase 1B.
yeah,
and so the key is to get them vaccinated. And, you know, I don't know what kind of interest there is in vaccination. Hopefully there isn't, you're not going to encounter resistance. But phase 1B is starting next Monday. And I know the first sort of focus is going to be on population 75 years of age or older, but the essential workers in phase 1B include, you know, K through 12 teachers, so and school staff. So I think the key is to get them vaccinated.
right. I agree. Do we have a timeline for when that group? I haven't heard yet. We have the meeting tomorrow with the state DPH tomorrow morning, but
yeah, you're going to hear it starts on Monday.
Yeah, and that's for the 75 and older.
Well, it's actually phase 1B starts on Monday, and so they're going to talk about the rollout to everybody that's listed as an essential worker. I just I did a press conference with the governor just now, and you know, obviously our focus was on the 75 population, but they're in the same group.
Okay.
So I think he wants to, because there's such pressure, because there's such a vulnerable population, to try and get that started, and then you know, phase in the rest of those essential workers very shortly thereafter. So I think by the end of next week, early the following week. So if you're ready to go with your rosters and get to upload them in VAMs, and then look to places like Griffin that have high throughput and lots of appointments for vaccination, you can get your people done. And then depending on the vaccine they get, it's either 3 or 4 weeks, they'll have their primary and their booster dose, and they'll have immunity, which would be great.
Yeah, definitely. I know some districts have put out a letter, and I don't know if it's a survey of sorts, but you know, asking who's interested in the vaccine. You know, is that something you advise as well, just to get that information up front?
Yeah, you know, to be honest with you, we've encountered a fair amount of resistance in certain populations. So we've seen more resistance in younger populations. And, you know, so we did phase 1A vaccination. We've done a little over 10,000 since the 15th of December. And, you know, the uptake of vaccine in hospitals and nursing home amongst staff is about 50 to 55%. So it's about 45% of the staff up until this point has been reluctant or unwilling to be vaccinated.
Well,
and there's a lot of misinformation out there, unfortunately, circulating on social media about the vaccine.
right.
And, you know, we're trying to counter that through information. So to the extent that we can help you with that, we've compiled lots of information that's, you know, understandable by the general public, and everything from video to printed material. And you're going to have to be a little bit relentless about it to overcome some of that resistance, but that's going to be the key.
Yeah, we had a meeting earlier with our legal counsel, you know, just on vaccines and what you can require and not require, and it was pretty interesting. So I know Stacy Buden, our HR director, is here. She attended that as well. So that was helpful. But
Stacy, are you going to mandate it?
We're still discussing that right now.
Yeah, up until a couple of weeks ago, the thought was you couldn't mandate it, but the EEOC came out with a pronouncement, said you could. I haven't heard anybody mandate it yet.
Right. Exactly. They said, can you? And then the next question was, should you mandate it?
Well, we were hoping Stacy was going to be first so we can follow her lead. Somebody's got to be first, Stacy.
I know.
Hmm. Well, I guess that might be up to the Board of Education to decide. All these fine people in front of you. Does anyone else have a question? I know your time is very valuable, and I really appreciate you being with us tonight. You've provided a lot of great information. Anyone else have any questions or no?
Just wanted to say thank you on behalf of the board for you, taking a little time and talking this through with us. We appreciate it.
That's a pleasure. Let us know if there's anything else we can do. And if you want me to facilitate that conversation with Michelle, please let me know.
Okay. Thank you.
Thank you.
All right. Bye now.
Bye now.
Bye. Have a good night.
Good night.
Good night.
Thank you, Rick.
Thank you.
Thank you very much. Thanks.
So it looks like we have a question on the chat.
Oh yeah.
And someone's actually asking, it's kind of interesting. I didn't want to, bring it up when the gentlemen were on, but this person, I think the question, if you read it, is about communication and how families and children are being encouraged to go for the vaccine. Actually, it's about testing too.
Do you want me to share that, Becky, or do you want to?
Yeah, I think everybody can. I don't know if anybody can see it.
Yeah, I can see it now. I noticed it too, Becky, when he came on, but I was waiting for him to finish, but I can answer that. So the question is about, let's see, testing available. People aren't taking advantage of testing. I'll say that we've had hundreds of students get tested, and staff, a lot of staff too. And most of them are coming back negative. We're not seeing people who are just routinely going for asymptomatic testing. We've just had a couple that have turned out to be positive. These are people who just want to get tested. These are children, and they could be traveling. They could be visiting grandma in a nursing home. They could be having a sleep study or medical procedure. So we really do process a number, I would say at least a dozen or so more asymptomatic tests a day that we receive from students. So there really is good testing in the school, in the student body. There are some families that prefer not to test their children if they're quarantined, and doctors, prefer to just let them be and wait the 10 days if they're quarantining. And that's a choice that parents make, personally with their own doctor. But let's see, the second part of this question is that some people might be hesitant because of fear of the testing procedure. And that's a good point. That is something we could share more education about and more details about that, and to reassure people about the procedure. So good point there.
Yeah, initially when the test was being done, people were talking about how uncomfortable it was. But I don't believe that to be the case anymore. I think that was just the initial take on it. And but there are some people who are still just remember that piece of information and they're hesitant about it. So I think that would be helpful.
I had bulleted just a couple of concerns that I did want to bring up while we have Julie on the line, if that was okay.
Sure.
Great. So I believe C did email you my email. So I am concerned that we aren't seeing anything transpire in the school. We do know that a majority of students are asymptomatic or have mild symptoms. We also do know that if a parent tests positive, right, or parent tests positive and then they have their family tested and the student tests positive but is asymptomatic, it's a chicken and egg situation. You can't know definitively if the student had it before the parent was tested and shared it with the parent, or the parent shared it with the student. So I see the links, and I'm sure that everybody's calling everybody and doing everything they can. I don't doubt that. But it is a concern about, we know the percentage is high in asymptomatics, and it's a real concern when it's almost even a red flag when you hear there's no spread in school, because anybody not in the medical field that has kids knows we love them, but they're little petri dishes, right?
Mm-hmm.
So, I am concerned. I'm also concerned when Shane says, he's not into it because the state's not into it. But I mean, to be fair, the state did give us guidelines on what mode to keep our schools in. And then they adjusted the guidelines in the referendum. And I mean, according to them, we should be doing all mitigating strategies, and we should be doing the least amount in person. We reach every single indicator. We are far read by the state's guidance. So if we were doing what the state said, we would not be in school full time. Our mitigating factors would be in place. So it's like, we're not following the state when it comes to that. And I understand that there's percentages out in each school, but quite frankly, it's not evenly spread per classroom. So my kids have 5 out in their classroom. A friend's kid may have 1 or nobody out in their classroom.
Mm-hmm.
So even though there's less students in school, it isn't equally distributed. So I don't think we're going with the state. And then what the CDC has came out with recently, the 6th of January, was the new information on why we would want to expand and do asymptomatic testing in school. And there's a whole plan on how to try to coordinate that and how to go through the state. And again, everybody seems to have a color chart. And per the CDC guidelines, we're at moderate, and it looks like we're going to be inching over to higher risk of transmission in school. So we're here.
Well, I'm going to let Steve, answer the questions about the school, the learning model that we're in. But backing up to your first question about how the process begins when someone's positive, I can say that that's not how we're seeing it happening with cases. What we're seeing is a family will have an exposure, and they'll know a very close contact, usually unmasked exposure to a family member, a colleague. Children might have a play date with an unmasked, play date with an exposure of the positive person. And then those people are quarantined, and we sort of follow that family. And then they get tested. Initially, they might be negative, but then they test positive from that exposure. And so do we know for sure that came from that particular exposure? No, of course, we could never know that for sure, but it's a known contact for that person, an unmasked contact. And so we don't see too many cases where we don't know, where the person has not had a close contact in their personal lives. And it is often the parents testing positive, or the siblings first. Older siblings who are college students, grandparents, parents, even before the kids test positive.
Right. And I understand that, but especially when it's people in the house that would never have masks on. When mom's positive, if kid's asymptomatic, it's chicken and egg. Of course they've been.
Right, but we're not seeing as a family in a classroom who's developing symptoms and doesn't have any close contacts in their personal lives. We've seen that once or twice, but we haven't seen that in the same classroom, and we haven't seen that very often. It's just, a couple of times compared, with the 87 or 90 positive cases we've had.
We haven't seen any outbreaks in a given school or even in a classroom. We haven't seen any of that. When I've asked Shane multiple times, our local health director who talks with the state health directors every week, what he advises, because I want to make sure we're doing the right thing. And, this color chart is a guidance, and you have to read the whole document because the colors are just one part of it, and it really, they emphasize that. And Dr. Matt Carter, the head epidemiologist for the state, emphasizes how this has changed and evolved since this whole thing began. And they developed these metrics because they thought it was going to spread like potentially much more than it has in schools. And every week we hear the same thing, that hasn't been the case anywhere, and because the mitigating strategies are working. So they're saying, adherence to the obviously the design of physical space and the cohorting, which we're doing, the compliance with the self-screening. Our families have been very good. Our ventilation systems are all state of the art, and operating in alignment with the CDC and DPH. We're cleaning and disinfecting like crazy. The masks wearing has been tremendous. Our kids are doing a great job. Families are doing a great job. Our buildings are not densely populated. You know, some school districts have far more kids in their classes than we do. Our classes are nicely spread out. So, you know,
But not 6 feet spread out, right? I mean, we're not doing all the mitigating strategies. We're not 6 feet apart in our
not
building.
every class. We are in a lot of the high school classes. Most of the high school classes are 6 feet. So, you know, in the elementary, we're contact tracing the entire class because those kids move around. They're together all day. So we're quarantining the entire class if someone's positive in a classroom.
So, sorry, when you quarantine the classroom, how many of those kids are actually being tested?
We can't require it.
Well, no, I got it. But about like,
It depends. Usually it's just a couple kids, but that's not the only thing we look at. We look at the whole class, the families. If we had, you know, what would be flags for us if, even though we're bringing back an entire class and no one is tested positive and they're not symptomatic, we would worry if their families became sick, because then we'd wonder, was the student asymptomatic? But that's not happening either. We're not seeing families getting sick when children are quarantined from a class either. Right. And how would we know that? Because then they'd be a close contact and they'd be staying home. And so, you know, the nurses are really carefully case managing every single family, and Stacy Buden as well, with the staff that calls us with any situation, whether it's that they're a close contact or their child has an illness. We're not having any children, very, very rarely come to school with any symptoms at all. So in terms of kids being Petri dishes, you know, we're not seeing that. Kids, they've been excellent. They're wearing their masks. They're really supporting each other. They're doing a great job with their social distancing at recess. Parents are being wonderful about not sending in kids sick. Even runny noses, congestion, mild things, they're staying home till they're symptom free. And they're really reaching out to nurses every day to get support. And so we really have, you know, a strong relationship with the school nurses have a strong relationship with their, you know, families. And that's really what's helping us to do very well.
Right. And the science is great. And it's great that our kids are not seeming to be as sick without underlying conditions. It's great that we're not seeing that. I just want to ensure that we are doing everything in our power to make sure our staff and our students' families and our community is protected. And you know, I've asked before, when do we go back and incorporate all mitigating strategies? We haven't made any move to change our modality of schools. So it's, you know, it's kind of like trying to have everything of everything, you know. So if we were asymptomatic testing, all right, we're in school full time, but we are really making sure that, you know, it's not spreading around. And where they are asymptomatic testing, you know, it's scary in the beginning because they're finding a good amount of cases and then they're pulling them out. In fact, asymptomatic testing just rolled out in the entire country of England. So
we're really not seeing that in the Plainville schools. The hundreds of asymptomatic testing we've only had a handful, a couple of kids tested positive, as well as staff.
Well, I mean, we're not doing,
yeah. So we also have seen most people who test positive, no matter the age, are symptomatic.
Right. No, right. But well, countrywide, statewide, there are a large percentage of people that are asymptomatic. What I'm saying is schools that are doing asymptomatic testing, DC just did a big study, Boston just did a big study, Rhode Island's under a big study. They're seeing initially they do find a lot of cases and they're able to precisely clear them out and move on from there. So that's what I wanted to bring to the table.
Unless you're testing every student and staff member every day or every couple of days, you're not going to pick up every single asymptomatic case.
No, they have a precise way they do it though. Like one district was doing it depending on their community rate and where they are on that community metrics. Once they, or after a holiday break, they did what the state just called a one-time test. They would test the whole building before coming back before a holiday. And then once the town moved to say orange or red, there was 20% of students and staff tested weekly until the community level went down. Has been the most common way that I've been seeing it done.
Yeah, so I mean, I would just say that what I've told you all along is that I'm following the guidance of the advisors that I'm supposed to listen to from the health department. And, you know, I've asked, should we be looking at a different model? And the answer's been definitely not. Keep your kids in school. You're doing a great job, and the schools are doing a great job. I've heard it from the state epidemiologist, you know, the top person in the state, all the way down to the local level. And, you know, extremely impressed by what schools are doing in general. And I think we're doing a better job than most schools. You know, to be 100% safe and foolproof, we could keep everybody in full remote learning the entire year like New Haven's done, but, you know, there's a whole cost to that. There's a whole other side of impact on kids that is very negative. So, you know, I'm not going to put people's health at stake. If I'm told that you shouldn't be doing this, I'm going to follow the health director's guidance.
Right. And that's the thing, like, is you said he doesn't come to Board of Ed meetings, and it does kind of put you in a position, you know, where I feel like I'm questioning you all the time. I wish I'd met Shane, because quite frankly, I served on the Health and Safety Committee. I haven't met him through this entire process, but it is a little frustrating when, you know, we're not following the state guidance. I'm seeing the CDC even come on the same page with some things, you know, I wish we could ask, you know, have a conversation with Shane too, and find out, you know, it's just, he seems to agree with state on some things, but their guidance to modality, not so much so.
So you're referring to like the hybrid, if we were to go into a hybrid model, because that would be safer, or?
Right, to any of it. I mean, the state guidance is there for less in-person learning, but that doesn't seem to come up, you know, that's not something that's,
There
that is
is
the
there
most,
for consideration of less in-person learning, and it says to factor in all these other pieces that are also considerations.
yeah, and we meet every single one of the 8. I don't think there's one we don't meet, right?
Rebecca, that's true of every town pretty much in the state of Connecticut. Right?
Yeah, and
So-
over 60% are hybrid.
Who else is doing this? And the gentleman from Griffin Hospital, you know, that we just had on here also said he wouldn't recommend it. Dr. K, our medical advisor, doesn't recommend it. Shane doesn't recommend it. I know what you're saying, and I see what they're doing in maybe large communities like Boston and whatnot. But I mean, my experience as well with, you know, the 5-6 districts I work with, if there was a lot of spread happening with kids in school, by now, asymptomatic kids in school spreading and then going home to their families, by now we would know that. But it's not happening that way.
Well, one thing I would definitely ask that can be controlled by the people right here in this meeting is, and I did want to say the community health center, I do get tested there biweekly. It's usually a 20-minute wait. So I think maybe you did have a bad date.
Timing, yeah.
But, you know, education to go out to families about testing not being as scary. I know CHC even has videos, because I know that came up in an email about parents and students thinking that testing is, you know, could be traumatic or things like that. More education about that, more education about getting asymptomatic tested, and, you know, the impact that makes based on state and federal guidance.
I think we can always do a better job at communicating to people, and it's hard because everybody's on communication overload, but certainly I think we could do a better job at communicating to people. The other thing, I had people I know who went and paid. They went to their community health center and they paid because they got coded incorrectly, and she said, you know, it cost me $160. I said, oh no, no. It shouldn't have cost you anything. And they went back and found they shouldn't pay. So that's another thing I think people don't understand, that when they go to a place like that, that it doesn't cost them anything either. And that could be a barrier. So there are some things there that we can do to definitely encourage the community in general about testing, so they don't fear, you know, getting a bill. They don't fear what, you know, it being true.
I just replied that to Miss Montana, who's watching, you know, joining us tonight. And, you know, and she mentioned that resources at some of the private schools and the colleges, you know, there's more being done in some of the, you know, where there's a lot more accessibility and money and things like that. But, you know, given the resources we have and the community we have, and you know, I think a lot of care has been taken just going, if you walk around any of our schools and look at in the classrooms and all the strategies and the mitigations and the actual schedules and the structures and the way we do specials. And there are hundreds of moving parts in our reopening plan, and it's evolved and changed since then as well. But, you know, our staff is taking it incredibly seriously. The kids are doing a great job. The families have been very supportive. You know, our cases overall, you know, are still, in my opinion, very low with 92 cases over almost as many days. It's about a case per day in the schools. And, you know, we never have all the answers about what case came from where exactly. But the work that Julie does and Stacy does is pretty thorough as far as tracing it. I know we have to go on to the other board meeting now, so we'll have to end, but you know, I appreciate y'all joining for the discussion. I really appreciate Rick and the folks from Griffin joining us as well and shedding some light. You know, I can ask Shane again if he's willing to have a conversation, whether individually or with the board or with the town council, because he does attend like some of the finance meetings, because I think Robert's his shared boss with the other two town managers. But you know, and I appreciate the push and the pull and the information, and you know, because I think that just makes us better and more careful and look at things more deeply and make sure we're doing the right thing. But like I said, I'm always going to follow what I'm being told to do. For the most part, I veered a little bit from that with the remote days that I chose. They said we should keep the kids in person. So if anything, I err on the side of caution and kind of supporting the staff and also our administrative struggles with staffing at times. But so I know we have to go because there's probably people waiting in the other meeting, but Becky.
No, it hasn't started yet because I can't do two at once. So
yeah, come on, Kevin.
It's going to be a minute before you can get in. So give me a couple minutes to get it done.
Okay.
All right.
Or say something now, or I can wait until the board open forum. It's up to you guys.
Go ahead, Nicole.
Okay. I just want to say that I'm cautious about having the school get involved with asymptomatic testing. I know that we need parental consent, but I also think that it's a slippery slope to saying, well, if you won't consent to it, we're not going to let your child go to in-person. And I don't necessarily like that. And as far as vaccines, I would say that I'm 100% against mandating them for anyone. So I hope that there's long discussions about that before anyone says that they're mandated.
Just coming from the shipment and going perspective, you know, it wasn't, unless I'm incorrect, Stacy, I don't feel that they were thinking that was a good idea to mandate it or necessary, you know. So we're going to feel it out, but I think we're going to have a large majority who are going to want the vaccine. You know, ultimately, I think they said you want 75% of your population to have it if possible, but I know we have to get over the other meeting, so I'll stop because you know me.
All right. Well, we'll all go out and switch back over, but thank you very much, Julie and Stacy, for joining us and helping out.
Thank you very much. Thanks, Julie and Stacy. I'll see you.